Casa de Salud opened in 2010 to help St. Louis's immigrant community access health care. And today they have doubled the size of their clinic and serve patients 7 days per week. Joining us from Casa de Salud is President Jorge Riopedre. Welcome, Jorge.
Thanks for having me. I appreciate it.
So Casa de Salud right here in St. Louis.
Yep.
Tell us about it.
Casa started 7 years ago with the idea that it would serve people who were uninsured, with a particular focus on the immigrant and Latino communities, especially because at that time, even more so than now, Hispanics led the nation in rates of uninsured. That's not only bad for them, that's bad for the entire community, both because when people remain sick, it's bad for all of us, and because of the increase in premiums that occur when people can't get access and they can't pay for it. So Casa tried to fill that role, and that's what we've been doing for the last 7 years, providing on-site primary care. So in other words, what you or I would get in our own doctor's office. And then if you have a situation that cannot be dealt with in a primary care setting, we have patient advocates who then attempt to get you care outside of Casa with specialists. And that team will do everything from refer you to the other location. They'll negotiate the price ahead of time for you with that receiving institution. We'll go with you to the appointments to act as your advocate. And if you are diabetic or hypertensive, we will even send that case manager and a nurse to your home to help you manage the disease.
Okay, wow, that's a lot of stuff.
It is.
You guys are doing a lot of good things. All right, so let's back up for a minute.
Yeah.
So how many medical clinics do you have, and where are they, or is it located?
We just have the one.
Okay.
It is on the corner of Choteau and Compton in Midtown. We have 70 volunteer physicians who work with us there. And then our partners are all over the region, from the largest hospital, Barnes, to single practitioners throughout St. Louis.
Okay, so the location is Choteau and Compton. Is it walk-in or appointment only?
It is. We will take walk-ins, but we try and have people make appointments, because if not, it can be very difficult to get people in because we have high volumes. And since the doctors are volunteers, if their shift ends at 12, I can't ask them to stay till 1. So I have to stay on the schedule.
So 70 doctors, 70. And now, are these doctors all, do they speak Spanish? Are they bilingual?
Not all of them, and they are doctors, nurse practitioners, psychiatrists, and physical therapists.
Okay.
And a few of them speak Spanish. Most of them do not. We have a Language Access Metro Project. LAMP is the organization that works with us to provide interpretation in the clinic for other languages. We also have volunteers who simply come in to do the interpretation for us.
Okay. All right. So over the last 6-7 years, things have changed. You had mentioned earlier that the uninsured population is actually down. So more people have insurance now.
Right.
How has that affected your mission? And how has the community changed here in St. Louis, the Hispanic community that you're really working with?
Right. So uninsured rates across the country are down thanks to the Affordable Care Act. However, a lot of people were left out of the Affordable Care Act, either because of legal status or because in the case of Missouri, it did not expand Medicaid. So for a variety of reasons, even though the Affordable Care Act did in fact have a very positive effect, there were still lots of people who remained uninsured. So for us, our patient volumes have actually escalated. In terms of the communities that we serve, the Hispanic community specifically has, as all foreign-born communities here in St. Louis, have continued to incrementally grow. Not as much as surrounding states and cities, but has been growing. We are attempting to grow with those communities, and we're trying to make sure that people understand that you do not have to be Hispanic to come to Casa de Salud. You just have to be uninsured. We take anyone who's uninsured.
Okay, so you have to be uninsured. If you have insurance...
We ask you to go somewhere else because we have limited resources, and they are targeted for people who have no other recourse.
Right, right. So how many people do you turn away?
We have a waiting list for about 2 to 3 weeks right now.
Okay.
We're seeing about 400 people in the clinic per month and delivering about 700 services to those people. At the end of the day, even though we're open 7 days a week, I only have so many slots. And the average patient that comes to Casa, our doctor and nurse spend an hour with them. I don't know about you, the last time I was with the doctor, 7 minutes. We take a lot more time. We provide a lot more care. The flip side of that is that means we can accept less overall people.
Right, got it. Wow, you guys are busy.
We are.
We're going to take a quick break, Jorge. Please stay with us at STL Live. We'll have more with Casa de Salud after this break.